Hello, my name is Dr. Hillel Mazansky and I specialize in medical hypnosis, guided imagery, nutrition and exercise, my website being gianinc.com. Today we are going to discuss migraine headaches, the triggers and the treatment. Migraine headache is very common in the United States and it tends to come especially in females rather than males. The headache is described as an intense unilateral or one-sided headache, usually around the temple, and it is really a severe type of headache. It is precipitated usually by certain foods or stress or hormones. It usually comes in younger females and not so much in the elderly. 5% of children also suffer migraine headaches. The headache is accompanied with flashing lights, nausea and vomiting, irritability, and depression. 20% of migraine sufferers get what is called the aura. Prior to the onset of the migraine, they see flashing lights, or the so-called blind spot where they cannot see. It might be in the form of dots or lines. There are many causes for migraine headache. Stress is a major cause for migraine headache, as is seen during those periods when migraineurs undergo severe stressful situations. Whatever the cause, the migraine tends to occur. There are certain foods that can affect the migraine, and those are the so-called tyramine containing foods. Tyramine is an amino acid which comes in aged cheese, pepperoni, soy sauce, and prepared foods. So if one develops migraines, they should desist from taking those foods. The migraine headache can also be precipitated by certain sounds or lights or reflection of the snow and the light. So whatever the precipitating factor is in your case, it is best to try and avoid it. The duration of the headache lasts anywhere from a half an hour to 2 hours. The treatments for these headaches are: some use over-the-counter medication and anti-inflammatory agents. Others need the stronger medication called the triptans, which, if taken early on in the course of the migraine headache, can abort the headache. However, one should be very careful of not taking too many of the triptans, because you develop what is called a rebound headache, and as a result of taking the medication, you get more headaches. Drinking a cup of coffee can oftentimes help, because the caffeine helps to dilate the vessels when they are constricted. However, taking too much coffee is not advised. Alternative treatments such as acupuncture can definitely help. Other treatments that are used are medication that is given to prevent the migraine from coming, such as antidepressant medication, or even the heart medication called beta blockers. They are used as a preventative to prevent the person getting the migraine headache. Hypnosis has been shown to help, in as much as it is used to control the recurrence and decrease the onset. As soon as the onset begins, certain hypnotic techniques are shown to the patients to use, and while the headache is in progress, other techniques are used to abort the headache. Whatever works for you is fine, and oftentimes one has to choose various methods to prevent the migraine from coming. It is also very good to keep a migraine diary. In other words, every time you get a migraine headache, to write down what your feelings are. Were you stressed? Was there a problem? Were you having your periods? Because hormonal changes can affect migraine, such as when you menstruate, you get a decrease in the estrogen level, and that can precipitate the migraine. So it's important to write down what happened prior to the onset of your migraine. You keep that diary and present it to your doctor. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.